Obesity Health Guide, Evidence-Based Prevention and Treatment Strategies. Obesity is defined as having an excess amount of body fat. Directly measuring body fat is difficult. So body mass index, BMI, is commonly used as a screening tool to estimate healthy body weight. BMI uses a mathematical formula based on your height and weight. It can provide a general guideline, but waist circumference and other factors also help determine excess body fat and health risks. BMI below 18.5 is an underweight. BMI 18.5 to 24.9 is healthy. BMI 25.0 to 29.9 is an overweight. BMI 30.0 to 39.9 is an obese. BMI over 40 is a morbidly obese. Obesity has been conclusively shown through extensive research to increase the risk of developing numerous health conditions that can severely impact quality of life and lifespan. These include high blood pressure, type 2 diabetes, heart disease, stroke, certain types of cancers, liver and kidney disease, sleep apnea, osteoarthritis, and infertility. The risks tend to rise with increasing degrees of obesity. Abdominal obesity appears to be an especially high-risk form that is associated with metabolic abnormalities. Excess visceral fat stored deep inside the abdominal cavity is metabolically active and has been linked to inflammation, insulin resistance, and other cardiometabolic disorders. A waist circumference over 35 inches in women and over 40 inches in men signifies increased risks. The development of obesity is complex with many interacting factors. Genetics: while genes do not doom a person to become obese, they can increase susceptibility. In rare cases, a single gene mutation can cause severe early onset obesity. Physiology: there are varying theories regarding metabolism, weight homeostasis, and predetermined weight ranges. None fully explain obesity. Diet: consuming excessive calories, particularly from high-fat, energy-dense processed foods, is a key driver of weight gain over time. Physical activity: sedentary modern lifestyles with low daily energy expenditure contribute to positive energy balance. Obesogenic environment: aspects of neighborhood design and layout, food marketing, economic policies, agricultural subsidies, and other systemic factors shape behaviors and access to healthy affordable foods and activities. Mental health: conditions like depression and emotional eating may increase obesity risks. Medications: some drugs used to treat health problems like diabetes and mental illness can cause weight gain as a side effect. Socioeconomic status: data consistently shows higher obesity prevalence among disadvantaged populations. Financial constraints, chronic stressors, and disparities are hypothesized risk factors. Treatment of obesity should take a comprehensive lifestyle approach focused on achieving long-term behavioral changes. Realistic individualized calorie reduction combined with regular moderate/vigorous physical activity helps create the necessary calorie deficit for gradual weight loss at a rate of about 1 to 2 pounds per week. Structured programs with nutrition education, activity coaching, and behavior modification techniques can provide guidance. Anti-obesity pharmacotherapy can augment lifestyle modification, but effects tend to diminish once drugs are stopped. For severe obesity, BMI greater than or equal to 40 or 35 plus with comorbidities, bariatric surgery is an option after failed conservative attempts that can induce dramatic improvement or remission of weight-related health conditions. However, surgery carries risks of complications and requires major lifelong dietary and lifestyle adjustments. Bariatric surgery treatment options for obesity. Bariatric surgery, also known as weight loss surgery, is becoming an increasingly common option. For patients with severe obesity, body mass index, BMI, greater than or equal to 40 kg/m2 or greater than or equal to 35 kg/m2 with comorbidities. The major types of operations include sleeve gastrectomy: the surgeon removes about 75% of the stomach, leaving a narrow, banana-shaped pouch connected to the small intestine. Expected weight loss is 65 to 80% of excess body weight within 1 to 2 years. Gastric bypass: this procedure reduces the size and absorbing function of the stomach, leading to decreased food intake and calorie absorption. Weight loss at 5 years post-surgery ranges from 60 to 80% of excess weight. Adjustable gastric banding: an adjustable stomach band is placed around the upper stomach via laparoscope, creating a sense of fullness with small food volumes. Used temporarily prior to more invasive treatments. Weight loss at 6 to 12 months is 21 to 28% of excess weight. Potential complications and adverse effects of bariatric surgery include hernias, infections, blood clots, leaks from resection line, nutritional deficiencies, nausea/vomiting, heartburn, chronic pain, anxiety/depression. Patients must adhere to a lifelong diet with restriction of volume and thorough chewing of food as well as avoidance of overeating. Alcohol dependence is considered a contraindication. Bariatric surgery has proven to provide significant and sustained weight reduction, as well as improvement or remission of type 2 diabetes and other obesity-related conditions. However, surgical intervention should be preceded by less invasive behavioral lifestyle modification approaches. Regular medical follow-up is necessary to monitor for nutritional imbalances, substance abuse risks, and weight regain. Some evidence-based healthy eating recommendations for weight loss and obesity prevention. Calorie intake: creating a modest calorie deficit of 500 to 1000 calories/day enables safe, gradual weight loss at a rate of 1 to 2 pounds per week. Intakes should not fall below 1,200 daily calories for women or 1,500 for men without medical supervision. Tracking intake alongside hunger cues aids adherence. Macronutrients: while evidence on optimal proportions is mixed, carbohydrates ranging between 40 to 65% of total kcal, 15 to 35% from fats, and 10 to 35% from protein covers most balanced eating patterns. Emphasizing fiber-rich whole grains, healthy unsaturated fats, and lean protein support satisfaction. Ketogenic diets severely restrict carbs to promote fat burning and can aid initial weight loss but have low adherence and unclear longevity. Fruits and vegetables: consuming abundant produce provides essential micronutrients, antioxidants, and fiber while helping displace more energy-dense foods. At minimum 5 servings, 2 cups, of vegetables and 2 servings, 1.5 cups, of fruit daily is recommended, with variety in color and preparation. Focusing on whole items over juice limits free sugar intake. Hydration: adequate water intake maintains metabolic health. 0.5 to 1 ounce per pound of body weight supports organ function. Temperature regulation, digestion, and transports nutrients without adding calories. Caffeinated or alcoholic beverages tend to have a mild diuretic effect. Overall, the components of a balanced, portion-controlled, minimally processed diet centered on whole foods lays the foundation for healthy, sustainable weight loss while delivering proper nourishment to prevent deficiencies. Social support and addressing barriers like access and affordability facilitates lasting adoption. Regardless of current size, the prevention of unhealthy weight gain is a public health priority. Primary prevention of obesity involves creating environments, policies, social norms, and individual behaviors that promote the maintenance of healthy body weight across the lifespan through proper nutrition and regular physical activity starting from childhood. The global obesity epidemic calls for urgent population-level intervention strategies, as well as appropriately targeted clinical prevention efforts. As experts in medicine and public health, we have an ethical responsibility to advocate for and implement systemic changes that confront the societal drivers of obesity to create greater health equity. The application of science-based recommendations in clinical practice guidelines and public policy reforms is imperative. I aim to expand on some of the key details around health implications, risks factors, and solutions while hitting the requested length. Please let me know if you would like me to modify or add anything further. Some of the major health conditions impacted by obesity in greater depth. Obesity has been conclusively shown to increase the risk of developing numerous serious health conditions that can severely reduce quality of life and longevity. Cancers. Excess body fat is an established risk factor for several cancers, including endometrial, uterine, esophageal, liver, gallbladder, kidney, pancreatic, colorectal, ovarian, thyroid, multiple myeloma and meningioma. Those with class 2/3 obesity, BMI greater than or equal to 35, have a 20 to 50% increased risk of developing these cancers compared to normal weight individuals. Possible mechanisms relate to metabolic dysregulation, inflammation, and hormone imbalances associated with excess adiposity. Fatty liver disease. Non-alcoholic fatty liver disease ranges from simple steatosis to steatohepatitis and cirrhosis. Up to 90% of obese adults have some degree of fatty infiltration of the liver, which drives hepatic insulin resistance and liver enzymes abnormalities. Weight loss can help reverse accumulation of liver fat. Reproductive issues. Obesity can negatively impact fertility in both women and men. Links to menstrual disorders, polycystic ovarian syndrome, reduced conception rates and lower IVF success rates have been found. During pregnancy, obesity increases chances of complications like gestational diabetes, preeclampsia, operative deliveries, stillbirth and congenital defects. Mental health disorders, obesity rates are higher among those with major depressive disorder, bipolar disorder and schizophrenia compared to the general population. Both biological and psychosocial factors are likely involved in the complex interplay between obesity and mental illness. Musculoskeletal disorders. Excess weight strains the musculoskeletal system, especially weight-bearing joints like knees and hips. This accelerates cartilage destruction, leading to considerable pain, disability, decreased mobility and quality of life. Obesity is also associated with several soft tissue disorders. Sleep disorders. Obesity can impair respiratory function, which contributes to hypoventilation syndromes, such as obesity hypoventilation syndrome and obstructive sleep apnea. Fat deposits around neck and trunk compromise airway opening, leading to snoring, breathing pauses, oxygen desaturations and sleep fragmentation with resultant daytime fatigue. Up to 40 to 90% of obese individuals suffer from obstructive sleep apnea. Some key evidence-based obesity prevention recommendations across different age groups. Infants and toddlers. Breastfeeding has been shown to lower obesity risk later in life. Breastfed infants may self-regulate milk intake better versus bottled. Policy and cultural support for breastfeeding continuation is important. Complementary feeding guidelines recommend exposing infants to a variety of healthy foods, textures and flavors, including fruits/veggies. This helps develop eating habits linked to lower obesity prevalence. Physical activity guidelines for toddlers/preschoolers include 180+ minutes a day of a variety of play-based activities that develop movement skills and build active lifestyles. Children and adolescents. Addressing weight bullying and stigma is crucial, as victimization takes major psychological and physical health tolls. Increasing obesity risk by disrupting eating patterns and activity. Media literacy programs can counteract digital marketing that promotes overconsumption. Industry self-regulation has failed to shield youth from tempting ads. Schools can teach healthy living skills via culinary and fitness programs plus model supportive environments. With nutrition standards, time for active play and alternatives to food as rewards. Adults. Small sustainable lifestyle changes to diet and activity through midlife and beyond can prevent age-related and menopausal weight gain. Social support aids maintenance. Built environment enhancements like sidewalks, parks, recreation centers, and healthier retail outlets promote activity and nutrition among adults. Older adults. Preserving mobility and independence into old age relies on adequate physical capability. Obesity exacerbates age-related muscle loss if strength and balance goes unchecked. Addressing barriers to procuring and preparing healthy foods for homebound seniors can prevent malnutrition that hastens functional decline. Sustaining weight loss long-term poses major challenges due to the potent physiological adaptations and behavioral factors that drive weight regain. However, evidence-based strategies exist to improve maintenance. Continued adherence to modified eating and exercise habits is imperative for preservation of reduced weight, rather than reverting to previous lifestyle patterns. Gradual transition plans may help ease this adjustment. Cognitive behavioral relapse prevention training can equip individuals with coping strategies to navigate triggers, high-risk situations, and lapses. This centers on building self-efficacy, problem-solving skills and learning from setbacks. Exploring internal motivation and deeper purpose promotes persistence. Support groups foster camaraderie and accountability outside clinical settings. Given metabolic changes like leptin and ghrelin alterations, lowered energy requirements, and insulin sensitivity changes, maintenance calories often needs adjustment downwards from levels to initially lose pounds. This physiological plateau warrants attention. Anti-obesity medications used for 1 to 2 years after weight loss can boost adherence and double the odds of keeping weight off. However, effects dissipate upon discontinuing. Preventing regain after bariatric surgery also requires lifelong modifications and follow-up care. Deficiency monitoring, dealing with changes to digestion, as well as plastic surgery to tighten loose skin improves outcomes. Access to comprehensive weight maintenance lifestyle programs is limited despite some promising evidence. Mobile apps, online tools, coaching and weight monitoring enable remote upkeep of new behaviors. In conclusion, obesity is a complex chronic disease with serious medical and public health impacts that demand evidence-based preventative and treatment approaches. As rates continue rising worldwide, reversing this troubling trajectory necessitates tackling root societal drivers. through policy reforms rather than solely targeting individual lifestyle changes. Creating obesity-preventing environments with improved access to nutritious affordable foods and physical activity opportunities across communities holds promise for delivering health equity. For those with existing obesity or weight-related illnesses, judicious use of pharmacotherapy and bariatric surgery alongside Gulch-Standard lifestyle counseling can facilitate meaningful improvements. However, sustaining long-term weight management remains challenging due to physiological and behavioral factors which warrant further research into tailored maintenance support. Ultimately, addressing obesity requires eradicating weight stigma and reframing societal beauty ideals to promote psychological well-being alongside metabolic health regardless of body size. From clinical best practices to public health initiatives, multifaceted strategies with combined diet, activity, and cognitive emotional interventions grounded in empathy and the science of sustainability offer the clearest path to overcoming the worldwide obesity epidemic. Your health matters. Quali.health